Welcome back to the Reese Colbert Show here on SiriusXM Urban View. I am joined by friend of the show, no longer candidate, no longer scratching and surviving to get this nomination. She is the first Black woman to be elected U.S. Senator from the great state of Maryland. My senator, the one and only Senator Angela Alsobrooks. How are you doing,
Thank
Madam
you
Senator?
so much. Oh, goodness, I'm doing great. Thank you so much. As you were saying that, I was thinking, yeah, hallelujah. Thank you, Jesus. That was, woo, what a ride we were on. But I am just really so grateful to be here. You know what? And even though we're here in very troubling times, we show up. We
That's
want to be
right.
present when there's some trouble on the block, right? We want to show up when the decisions matter. And so I'm grateful to be here, even though it's a really troubling time.
Yeah. I think much has been made about this whole notion of Black people sitting out and Black women, the 92%, being on the sidelines. But with you being a senator, I'm so grateful that we have
Yep,
you here on the front lines because we are battling on so many fronts.
we are.
And and one of the things I know we're going to talk about this big ugly bill that the Republicans have going on, but you have truly been, I would say, in a league of your own in terms of the pushback that you have been forcefully pushing back on the Health and Human Services Secretary RFK Jr. You signed, you put forth a resolution of a disapproval, which Republicans blocked at the in the late of the night, and you've really been calling out a lot of his heinous junk race science. Tell people a little bit about the fight against the very dangerous ineptitude and incompetence of our HHS secretary.
Shocking. It really is. I mean, some of this, I've been sitting in these hearings with people that at times feels like being on Saturday Night Live. It just
Mm-hmm.
can't be true. This
Yeah.
man who had the gall in a hearing last week, if you heard it, to make a comment and say that China was ahead of the United States in healthcare because they don't have DEI.
Mm-mm-mm.
And as he said that, I had to say to him, you had the unmitigated gall to mention DEI as unqualified as he is. This is a man who has no background for his position. He's not a scientist. He's not a doctor. He's a quack is who he
Mm.
is. And beyond that, he's uncaring and
Yeah.
he's cruel. So what he has done is in first, and he said with his own words that we shouldn't trust him. He said the American people shouldn't take advice from him. Can you
Right.
imagine? So he should go home then, because what he has done is to fire unceremoniously thousands of well-qualified scientists, researchers, doctors, the people who not only keep us healthy today, but the ones who are researching the cures for cancer,
Mm-hmm.
ALS, Alzheimer's. This is serious business. HIV, AIDS, IVF. I mean, he's so indiscriminate in terms of the cuts that he's made, and he doesn't care.
Yeah.
We were asking him very specific questions about programs he canceled, and I promise you, he couldn't answer why or
Mm-hmm.
which program it was. But we know that it will not only devastate us today, but my concern is, I'm telling you, by the time this all comes to the people and they recognize the harm that has been done, much of which is irreversible,
Yeah.
we
Yeah.
lose this research, we can't get it back.
Mm-hmm.
And here he is in this seat, vaccines. We have measles all over the place, a disease that we thought we had really come up. Vaccines essentially helped us to cure.
Right.
We are
Right.
now seeing a resurgence of measles. Now, this evil person vaccinated his own children
Mm-hmm.
and is really making a lot of parents believe that it's not wise for them to vaccinate theirs.
Mm-hmm.
Yeah, it's awful.
Yeah, you know what else I was very troubled by? I was reading is that, apparently there are a lot of outbreaks and diseases that are spreading, and the CDC and the normal bulletins that we'll be getting from HHS are not coming out. Are they hiding what's happening with the health crises that we're facing in this country from the American people?
The first thought that came to mind is they don't have anybody to send them out because they fired everyone.
Mm,
So you're talking about the bulletins and such that can't come out. Well, how can they? If you go and fire entire divisions. That's what I'm talking about that they have done. We have, for example, a unit that oversees IVF and oversees the artificial reproductive area. Well, they went in and wholesale just fired people.
mm,
The same is true for the people who administer many of the programs, including Special Olympics. But when you talk about these bulletins with information, it takes people remember, to generate a lot of that
Right.
information. And they have not only gotten rid of the people, but you're right. I think he wants to substitute his opinion and views for the opinions and views of scientists, researchers, medical doctors, people with research. And you know how I know it? When I interviewed him prior to his nomination hearing, he
Mm-hmm.
told me, I am going to replace the bad scientists with good scientists. In other words, he has all these quack theories that he believes somewhere in his soul. And he has decided that he's going to espouse all of that and replace anybody who might get you accurate information. It's dangerous. He is a dangerous man.
Yeah, he truly is. And I know this is a little bit of a throwback, but I remember during his confirmation hearings, you question him about his idea that Black people, when he's talking about vaccines, he says just really insidious things. He said that Black people should have a different vaccination schedule, and you called him out about that. Remind people about that exchange.
Well, so he said that in a writing that Black people should be on a different vaccination schedule than white people. That's what he said. And he
Mm-hmm.
based it off of some study. And by the way, the author of that study then immediately came out and said, whoa, wait a minute, he has misrepresented the findings of my study and refuted what Secretary Kennedy said. And even so, he persisted in this ignorant perspective that he has, even though the author of the study that he cited said it was wrong. So I said to him, well, what sort of vaccine schedule should I be on then? This is
Right.
full of tomfoolery, is
Yeah.
what this is. It's all tomfoolery. And you know why it's so dangerous? There are parents who should be able to rely on what he says, who might make a decision about vaccinating their children based on the tomfoolery and the foolishness of this man, who would tell a Black person that they have somehow, this goes back years, this theory that there's something different.
Mm-hmm.
And we do know that there are medical differences. We know, for example, when we think about many of the diseases that affect us, we understand that there ought to be some research there. We think about, I'm trying to think about
Like
sickle cell.
fibroids is something that
Sickle cell,
disproportionately impacts, yeah, sickle
sickle
cell.
cell, they
Mm,
recently canceled some important research that was happening around sickle cell.
mm.
And so we know that there are differences, but where vaccines are concerned, the scientists who were writing these studies said that what he said was completely misrepresentative of their findings.
Mm. Well, I'm glad that you're there to continue to bring awareness to this, because I think people have kind of taken for granted that people in these positions tend to know what they're doing. And aside from the pandemic, which people forgot Donald Trump botched, typically things run smoothly enough to where people don't have to really think about how grants are being administered or what's being taken away or research being done. So please continue that fight. We're definitely behind you on that part. But let's talk a little bit about this big beautiful so-called big beautiful bill. It still is right aligned with the damage that's being done from the inside in terms of the agency, but a huge area of attack in this bill is around healthcare. And
Mhm.
Donald Trump, he's making headlines for saying don't touch Medicaid. And that's what the media tends to focus on. But explain to people what's actually in the bill as it relates to Medicaid and other health services.
Well, this is the simplest way I can explain it to you is the billionaires, as you can see, have gone nuts. They have run amok. They are excited because what the bill really intends to do is to make rich people, these billionaires, richer and make poor people poorer. That's a fact of the matter.
Mm-hmm.
The analysis of this bill says that the top 10% of wealthy people in our country will become wealthier, and the bottom 10% of people in our country in terms of wealth will become poorer. So the
Yeah.
poor get poorer and the billionaires get richer based on this. And that is really not any more complicated than that in terms of what their objective is.
Mm-hmm.
And what it does, however, is kicks off close to 14 million people off of their insurance. Is 13.7 or somewhere along those lines, million people who will be kicked off of their insurance as a result of this. It also impacts nutritional programs. And so and why? Again, to give tax cuts to billionaires. That's really what this is about. But cutting people out of Medicaid We're talking about children with disabilities. We're talking about, God forbid, none of us knows whether we may end up in a nursing home. But for those who may need that kind of care, our elders, their care is impacted in nursing homes through Medicaid. And so this is a really, really evil attempt. And the lies. And they believe some of them, the more they say it, the more it sounds like the truth. That he's saying don't cut Medicaid. It's intellectually dishonest, and he knows it. There is no way. We're thinking about at least $500 billion in cuts to Medicaid. It started out $800+ billion in cuts to Medicaid as a result of this bill, where I've been hearing over the last few days about $500 billion, but whatever it is, it's going to have a substantial and almost irreversible impact on the distribution of wealth in our country, which is all any of this is about. Anybody who's watching, the billionaires have run amok. They are raiding the government. And the whole intention is to make people, the rich richer and the poor poorer. That's really, it's a redistribution of wealth in our country.
Yeah, definitely. And it's unnecessary. These people don't need more money. They don't need more tanning beds. They don't need more yachts, private jets, trips to the moons. They're okay. They're doing just fine.
Well, even more than that, it's immoral.
Yes.
It's wrong.
Yeah.
It's wrong. Yep.
But I want you to explain, because I always try to connect the dots, because sometimes people hear Medicaid, that ain't me. SNAP, that ain't me. Medicare, eventually it will be people if you're fortunate enough to get old. But I want you to connect the dots for people who maybe they have private insurance, or maybe they have insurance through their employer and think this doesn't impact them. Can you just explain? I try to explain to people things like the economies of scale that come from these programs, or how Medicaid, plays into prescription drug prices that everybody pays and things like that. So can you just connect the dots for people who are hearing this and who feel like that's charity? And I ain't got time to worry about that. I got bills I got to pay and whatever,
Let me tell you something.
Yeah.
You better worry about it. And let me just to give you just one example of how this can come to your front door. I recently attended an event for Children's Hospital, and Children's Hospital explained to me that they're extremely concerned about these cuts to Medicaid, because what they will do is impact the level of care that they are able to give. If the reimbursement model means that you don't get reimbursed for the care that you give, you know what happens? The physicians who you might want to treat your loved one, your beautiful, precious child, when you come to Children's Hospital, well, that quality or caliber of physician may no longer be available to you, because they will leave those facilities if they cannot be compensated for the care that they provide. So it overall brings down the quality of care for all of us in these hospital systems if the reimbursement model says that you cannot be reimbursed for the care that you provide, which means that you, madam or sir, when you show up with your baby at this hospital who has either a disease or a condition that they need treated, you may not be able to get the quality of care that you need for your loved one. That is the reason, again, that it is not just that the poor should be concerned, all of us should be concerned. Healthcare, you never know where you might end up and what you might need. And that's the reason it is incumbent upon all of us to care about it. And I promise you, all of these cuts will hurt more people than you know. And again, we can't even perceive. There will be some impacts and consequences, I think, that we can't even foresee yet.
Yeah.
But they will be there. But that is just one example of how it will impact all of us, is the care, the level of care provided in hospitals, if the reimbursement model means you can't get paid for the care you provide.
Thank you, Senator, for that. I've been trying to tell people that, but hopefully hearing it from a U.S. Senator who is on the front lines trying to stop these cuts, it'll sink in. So thank you so much. I know you have so much going on. Keep up the good fight on our behalf.
You too. We're proud of you. Thank you for fighting.
Thank you. You're always welcome to come back if you have any more developments.
Okay. Thank you. Take care.
Thank you. Bye-bye.
Bye-bye.